Antiphospholipid Syndrome, APS, is a rare immune system disorder that can cause clots to form in your blood vessels. This raises your risk for several types of health problems, including heart attack, stroke, and miscarriage. Your immune system normally makes proteins called antibodies to protect you from unhealthy invaders like viruses. But when you have antiphospholipid syndrome, it makes antibodies that attack fat molecules throughout your body. That leads to cell damage, which makes your blood more likely to form clots in arteries and veins. The clots can form nearly anywhere in your body, from your brain to your lungs to your legs. Scientists aren't sure exactly what causes APS, which is most common in young women and those assigned female at birth. There's no cure, but treatment can help prevent blood clots from forming. About 5% of people in the U.S. have such abnormal antibodies in their blood that can lead to antiphospholipid syndrome. But some people with these antibodies never show any signs of the disease. To be diagnosed with antiphospholipid syndrome, you must have both the antibodies and APS symptoms. As with other autoimmune disorders, it's not clear what causes these antibodies to develop. Scientists think both genes and things in your environment are involved. Your chances of getting APS are higher if you are female or were assigned female at birth. Some 70% of those with APS are female. Have a bacterial or viral infection, such as HIV, syphilis, hepatitis C, or Lyme disease. Take the antibiotic amoxicillin, or certain blood pressure, heart rhythm, and anti-seizure medications. Have lupus. Up to about half of people with lupus also have APS, or another autoimmune disorder. Have relatives with APS. If you have APS antibodies, you're more likely to develop blood clot symptoms when you get pregnant. Have surgery. Have obesity. Sit for a long time, for example, on bed rest or a long flight. Smoke. Take birth control pills. Have high cholesterol or high blood pressure. Antiphospholipid syndrome affects 5 times as many women as men and is most often diagnosed in women in their 30s. That's one reason it's linked to pregnancy complications. Another reason is that pregnancy increases your risk for blood clots even when you don't have APS antibodies. More blood flows through your body to help support the fetus. This puts extra pressure on your blood vessels, which can make them narrower. Pregnancy hormones also make clotting more likely. Pregnancy complications linked to APS include a hard time getting pregnant, preeclampsia, high blood pressure, miscarriage, usually after the 10th week of pregnancy, premature birth, usually before the 34th week of pregnancy, babies born small or underweight. Treatment for APS can reduce your risk for these complications. Antiphospholipid syndrome symptoms. Blood clots are the most common symptom of antiphospholipid syndrome. Their symptoms vary depending on where in your body the clot forms. They may include pain in your chest, nausea, shortness of breath, pain, redness, and swelling in your legs or arms, changes in your speech pattern, discomfort in your neck, back, arms, and jaws, repeated miscarriages. Other symptoms might include bleeding from your nose or gums resulting from low levels of platelets, cells that help your blood clot, anemia, which happens when you don't have enough red blood cells, a rash that makes a lacy red or purplish pattern on your skin, damage to your heart valves, frequent headaches, memory problems. If you think you're having symptoms of a blood clot, get medical help immediately. Clots can be dangerous, and even deadly blood clots due to antiphospholipid syndrome can cause complications that may be serious, such as deep vein thrombosis (DVT). It involves the formation of a blood clot in the deep veins of the leg, the ones closest to the bones, which carry a lot of blood to the heart. DVT can also occur in other areas, such as the arms and pelvis. APS causes 15–20% of deep vein thrombosis cases. Pulmonary embolism. A blood clot in your lungs can block one of the arteries there, causing this potentially life-threatening condition. It most often happens after a clot in a deep leg vein breaks off and travels to your lungs. APS can also lead to high blood pressure in your lungs. Heart attack. This can happen when a blood clot in your heart blocks arteries there and stops blood and oxygen from flowing as it should. Stroke. Strokes result from clots in the blood vessels of the brain. They can cause speech loss, paralysis to parts of your body, and other issues that are sometimes permanent. APS can also lead to a less serious transient ischemic attack, TIA, or mini-stroke. Kidney damage. Reduced blood flow to your kidneys can result in kidney problems, including kidney failure. Catastrophic antiphospholipid syndrome is a very rare and dangerous complication in which many blood clots suddenly form throughout your body. This can damage multiple organs within a short time. Scientists don't know why this happens, but it sometimes follows an infection, injury, or surgery. If your doctor suspects you have APS, they'll give you blood tests to look for the 3 APS antibodies. Anticardiolipin. Beta-2 glycoprotein I beta-2 GPI. Lupus anticoagulant. You'll need to be tested 2 times, at least 12 weeks apart. At least one of the 3 blood tests must come back positive twice for you to be diagnosed with APS. Antiphospholipid Syndrome criteria. Just having the antibodies doesn't mean that you have antiphospholipid syndrome. You also must have a history of health problems related to it. Most cases of APS are diagnosed after a clotting incident or a series of miscarriages.